Maine public, we are just under a minute out. Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. Delighted to be able to join everyone to talk about where we are with respect to COVID-19 for the entire state of Maine for today, March 25th, 2021. Overall, across the state, we have now received reports of 49,190 total cases of COVID-19, an increase of 218 cases since yesterday. Of those cases, 37,981 are confirmed cases and 11,209 are probable cases. Sadly, overall throughout the pandemic, Maine CDC has received reports of 731 total deaths. And cumulatively, 1,647 people have been hospitalized with COVID. Of those, 78 people are currently in the hospital. 30 of those 78 are in an intensive care unit and 11 are on a ventilator. Among all of our cases, 4,376 are healthcare workers. Turning next to some updates on outbreaks. There are 3 outbreak investigations that Maine CDC has opened up in recent days that I wanted to comment on. These are outbreak investigations that have been opened since we last spoke on Tuesday. One of those epidemiological investigations is at the Aroostook County Jail, where we are aware of 4 cases of COVID-19. Another is at the Cross Point Church in Bangor, where we are aware of 11 cases. And then a third is an outbreak investigation at the Norway Center for Health and Rehabilitation in Norway, where we are aware of 20 cases of COVID-19. Turning now to some updates around testing. Our 7-day PCR test positivity rate has come down a bit to now being at 2.1%. And our PCR testing volume now stands at 566 PCR tests for every 100,000 people in the state. Turning to antigen tests, our positivity rate there on a 7-day basis now stands at 4.7%. And we're conducting about 145 antigen tests for every 100,000 people in the state. Now turning to vaccinations and vaccines. Let's start with vaccinations. Overall, across the state, we have administered 623,388 total doses of COVID-19 vaccine. Of those, 387,648 are first doses, and 235,740 are final doses of COVID-19 vaccine. To put those numbers in a bit of perspective, about 29% of people in Maine have received at least their first dose, and about 17.5% of people in Maine have received their final doses of COVID-19 vaccine. And among those who are in our currently eligible age tiers of those 50 and over half has received at least their first dose of COVID vaccine, and nearly 1 out of every 3 Mainers who is aged 50 and over have completed their vaccination series. We also, as a state, administered 18,407 doses of COVID-19 vaccine yesterday alone. We talked a little bit on Thursday about the pre-registration system. that Maine CDC has opened up. Let me talk about some of the numbers first, and then I'll talk about a little bit more today about what that is, who it's for, and how to access it. First of all, the pre-registration system underwent a soft opening on Tuesday. And notwithstanding that soft opening, we had 10,000 people pre-register in the first 24 hours alone. In the second 24 hours, we have nearly 20,000 people pre-register as well. As of this morning, 33,070 people have pre-registered for COVID-19 vaccine in the state. Now, let me talk a little bit more about what this pre-registration entails, who it's for, and what it actually leads to. Pre-registration via this platform effectively allows folks to say and raise their hand and say, I am interested in being vaccinated and being informed of when there is an appointment that I can schedule into. For those who are under the age of 50, you can say, in effect, even though I'm not eligible right now, I would like to know when I am so I can schedule a vaccine. And for those who are 50 and over, it allows you to say, I know that you are bringing on locations who will ultimately use this platform. When those locations have been brought online, please let me know so I can then go in and register officially because I'm in that over 50 category. Now, I want to stress something that I've mentioned before, but want to mention again. This platform is a resource through which you can schedule a vaccine. It is not the resource. Some vaccination sites in Maine will continue to utilize the platforms that they have developed and have been using throughout the vaccination process, including some that operate very large-scale sites. For example, the Cross Insurance Center in Bangor operated in partnership with Northern Light Health. They will continue to use their own scheduling system. Similarly, Scarborough Downs, operated in partnership with Maine Health, will continue to use its own scheduling system. But there are other sites, small, medium, and large, that currently exist in Maine or may be coming online soon that may opt to use this scheduling platform. Again, this resource for pre-registration and ultimately registration is a resource through which you can schedule. It is not the only resource through which you can schedule. It will work with some sites, but not all sites. Where we are right now is to work with a few of the key vaccination sites in Maine that have signaled to us that they are not pleased with their current scheduling platform and would like to transition over and utilize the state-sponsored platform. We are hoping to have those vaccination sites live and in the registration piece of the platform very soon, and that will complete the circle. Right now, we're focused on pre-registration to get folks to raise their hand and simultaneously bringing sites on so that when they are live and ready to go, we can go back to folks who have raised their hand and say, okay, thank you for raising your hand. Thank you for signaling your desire to be vaccinated. Here is how you can go about completing that process. Turning now to vaccines and vaccine supply. Here's what we are getting in terms of vaccine allotment from the federal government next week as a state. Maine will be receiving 45,200 first doses of COVID-19 vaccine for our allocation next week. That 45,200 comprises 13,700 doses of Moderna vaccine and 23,400 doses of Pfizer vaccine, as well as 8,100 doses of J&J vaccine. We do not yet know what the separate direct federal allocation will be to retail pharmacies, community health centers, and other such venues within the state of Maine will be. We usually don't find out about that until the weekend, typically on a Saturday. A few notes and observations about next week's allocation. The volume of Moderna vaccine that we are receiving next week is flat. And in fact, will be at the same level that it has been at for several weeks now. However, Thankfully, the increase that we are seeing in the Pfizer vaccine is significant. Next week, Maine will be receiving 3,510 new first doses of Pfizer vaccine. The same is said of the J&J vaccine, where we will be receiving an additional new allocation of 6,500 doses of J&J vaccine next week. This is welcome news all around. That increase in J&J vaccine in particular affords us significant flexibility. It helps us vaccinate, for example, residents and staff of nursing homes who may not have been vaccinated the first go around earlier this year. That increase in J&J vaccine also allows us to continue vaccinating homebound Maine people, folks for whom going out to the vaccine is not available. The J&J vaccine, however, because of its storage requirements, allows us to bring the vaccine to people rather than asking people to come to the vaccine. That same increase in J&J also expands options for people who have transportation or other challenges, who would therefore benefit from just a single dose of vaccine. And that J&J vaccine expands the scope of locations that can offer the vaccine, because again, it does not have the same stringent cold freezing requirements that the Pfizer and the Moderna vaccines do. So this week, we will be able to make allocations to hospitals in Millinocket and Skowhegan, as well as to EMS agencies from Buxton to Buckfield, who will both be receiving doses of the J&J vaccine so they can vaccinate in their communities. But there are some very important notes with respect to next week's allocation. The first is that the increase of Pfizer doses that I mentioned, 3,510 additional new first doses. We have been told by the federal government that that is a one-time increase. And as a result, this 28% week-on-week increase that we are looking at for next week may not last for the subsequent week, the week of April 5th. The second is that we still need more vaccine in the state. Although the volume of vaccine that we are receiving has increased steadily over the past several weeks, in my conversations with healthcare providers, large-scale vaccination site operators, as well as others who are involved with vaccination across the state, there has been one consistent theme. They can be doing more, which means that we need more vaccine, which also means that we are still somewhat supply constrained. Even though that is easing with each passing week, we are not yet at the stage where supply is not the constraint on speed. To put that a different way, the more vaccine we get into the state, the more quickly we can vaccinate people within the state. One of the things that my team and I have been doing over the past week is to work with vaccine providers across the state, to ask them how much more they can be doing. If they're doing 20 a day, what can they do to get to 40 a day? If they're doing 200 a day, how can they get to 500 a day? And if they're doing 2,000 a day, what can they do to get to 3,000 or 4,000 a day? And I am so thrilled with the cooperation and response that we have received from each of those vaccination providers. Without fail, in my conversations with them, when I have asked them to reach higher and push harder, they have come back and said, we will do that, we can do more, and we are prepared to. That gives me confidence in knowing that when Maine gets more vaccine, we can quickly turn those vaccines into vaccinations as quickly as possible. We all want nothing more than to be back on that return and road to normalcy. This robust headroom in our vaccination capacity, being able to increase the number of shots in arms every single day as our vaccine supply increases, that road, that pathway is how we will get there eventually. So with that, I'd like to turn things over to our colleagues in the media. The first question for today goes to Patrick Whittle.
Thank you very much. A couple of things. First of all, I would like to talk about a data point that I've noticed. According to our own data that AP has collected about the pandemic in Maine and elsewhere, the 7-day rolling average of new daily cases in the state has risen over the last 2 weeks from about 170 to about 200. But in that same time period, the 7-day rolling average of daily deaths has decreased quite a bit, from more than 3 to less than 1. And I don't want to make any assumptions, so I would love for you to talk about why that is.
Well, Patrick, I think that the vaccine is really what's going on there. There are some epidemiological changes that may be occurring, a bit more transmission than a low point that we reached 2 weeks ago, so on and so forth. But what is doing the lion's share of work behind particularly the decline in deaths is vaccination. I think I mentioned this, but if I haven't already, it bears repeating. We have gone more than 30 days in Maine without a single death that we are aware of COVID from COVID-19 in a long-term care facility. I want to say that again. It's been more than 30 days since we have experienced a death from COVID-19 in a nursing home in Maine that we are aware of. As you know, we do reviews of vital records. We may uncover one, but we have not yet been made aware of one in over 30 days. That is a direct function of the vaccination efforts that we undertook in December and January. But that effect ripples throughout the population. It's not just folks in nursing homes who have been vaccinated. It's all numbers of folks across communities. And that is, in my read, and as well as our team here, the primary reason why deaths have dropped so significantly and thankfully across the state. That being said, Patrick, you put that in juxtaposition to the cases. The number of cases has come down from our relative peak in January when we were seeing several hundred per day. It has come down since then, but recently it has trended a bit upward. There are some concerns on the horizon around that. We're looking into different reasons as to why that may be, some of which we've discussed. But certainly the surest way to keep that number of cases where it is and push it even further is to continue with our aggressive vaccine rollout.
Okay, great. So if we have most of the coverages of folks who are older than 50 and 60, obviously, is the declining number of deaths, is that at all evidence of the fact that now people who are contracting coronavirus are possibly folks who are less likely to suffer a severe illness or death? Is there a corollary there?
Yes, indeed. No, you are correct, Patrick. By focusing on Governor Mills's strategy to protect the most vulnerable, which in Maine entails those who are of an older age, by affording them vaccine first, whether they are residents of long-term care or congregate settings or folks who live in the community. By focusing on vaccinations for them first, we have reduced their likelihood of getting COVID and thus protected them. One of the benefits of that is that we have seen a significant reduction in the number of daily deaths, as well as deaths among those older tiers of the population. We are now seeing cases in younger Mainers, but as I think we talked about around a week ago, that is partly a function of who has not yet been vaccinated. But younger Mainers, thankfully, are not as high of a risk for death. So a lot of moving pieces there, but vaccines and vaccinations are really one of the keys behind that.
Great. One final thing, if I could. Earlier today, WMTW reported that Bangor Savings Bank is offering $500 to employees who get a coronavirus vaccine. I would love to know if the state is aware of any other incentive programs and if it's working with employers to do things like this, because we all love the 5% off your bottle of sunblock at CVS when you get a flu shot. $500 is pretty terrific.
Yeah, I mean, in recent days, it seems like there have been a number of such efforts across the country, ranging from donuts to arcade tokens and a number of things in between. I was not aware of the $500 incentive. I'm not aware of anything else systematic. I suspect that there are other such incentive programs. No one at Maine CDC is working specifically with employers around that. That again, perhaps there are others within state of Maine government who are, but I'm not aware of anything more systematic being rolled out Doesn't mean it won't and doesn't mean it's not, but we are starting to see these things. Again, most notably, as a lot of folks are aware, at the national level with Krispy Kreme just in the recent days.
Okay, thank you very much.
Let me turn next over to Morgan at WABI.
I'm here. I wasn't expecting to go so quickly, but thank you, Dr. Shah. So my first question, can you talk about sort of why we see the fluctuating numbers of supply from the different vaccine companies that are putting those out, why we might see a little more this week and why we may not see more the next time?
Yep, Morgan, I've asked a somewhat similar question, which is what's going on behind the scenes on the production front? How are they thinking about the future of vaccine and vaccination supply? To your particular question, a lot of what's going on is just the various production supply chains that are involved in taking a vaccine from its raw constituent chemicals and pieces to a finished product that is what we now know to be the vaccine. And sometimes they are able to do that in big batches, which I think is responsible for the Pfizer vaccine. They start up the process, they see a big significant spike in what they are able to produce, and then it drops down to a bit more of a steady state. With respect to the J&J, the story is a bit different. With J&J, soon after the vaccine was authorized earlier this month, the federal government took everything that had been pre-produced and sent it out in the field. They opened up the cupboard and they cleared it out to send to states so we could get it into arms as quickly as possible. Having depleted that supply, they were now left with recreating that supply. And what we're seeing now, later on in this month now, is that recreation, that bouncing back of the supply after having cleared out the cupboards. So it's a little bit of both depending on the vaccine.
All right, thank you. And then also I was wondering about if there's any more development for drive-throughs and or primary care providers getting any vaccine supply.
Sure. So drive-throughs, particularly with the increase in the J&J supply that we are getting, I think will be a little bit more of a commonplace feature among our vaccine landscape. So for example, in this allocation for next week, we are making allocations to the City of Augusta's fire department here in Augusta, to Buxton Fire Rescue, United Ambulance in Lewiston, the City of Bangor's fire department, so on and so forth, Reddington Fairview EMS, just to name a few, all of whom are planning different variations on the theme of a drive-through. Some may be entirely drive-through, some may be drive up and get vaccinated and go right back in your car, but they're all working on ways to speed up vaccine delivery. The J&J vaccine, again, is very well suited for that because it doesn't have those same cold storage requirements. We're also starting to hear from increasing numbers of folks who say, as we go into younger age tiers, folks who say, I just want to get my vaccine, I want to get it once, and then I want to get going. And the J&J vaccine meets their needs as well. So we think drive-throughs, as we see more J&J, will be an increasing feature.
And for primary care?
We're similarly working with primary care offices who wish to offer the vaccine. We're not there yet. We don't quite yet have the supply to be able to support providing vaccines to primary care offices yet. It's something that we are working on, but that is a function of supply right now.
Thank you very much.
Over to Steve Betts next.
Thank you, Dr. Shah. I had a question from some local hospitality owners, hospitality business owners. They want to know, what are the chances of their employees, a lot of them who are younger people, such as people who work on schooners, to be able to be vaccinated before the tourist season gets into high gear?
Well, we are still planning on April 19th, Steve, to open up our eligibility, not just to those 50 and over, but to those 16 or 18 and over. And I suspect that many of the folks who you note in the hospitality industry will be in those younger age tiers, though some may already be eligible if they are 50 and over. So come April 19th, just a few weeks away now, everyone will be eligible in Maine for any of the 3 authorized vaccines. If you're 16 and over for the Pfizer, if you're 18 and over for Moderna and J&J. So I think that sort of gives us a sense of what we would be thinking about in terms of the run-up or preparation for the summer tourist season.
Thank you very much.
You bet, Steve. Over to Amy Brown next.
Thank you, Dr. Shah. I want to revisit Piscataquis County, where about a week and a half ago, you were talking about a concerning rise in cases. I wonder if that was ever traced back to an outbreak or if it was determined whether there were any of the variants at play in that.
No, Amy, there was only one single outbreak, but not one that was thought to have generated much transmission. Thankfully, the situation in Piscataquis County has stabilized. We are not seeing the significant growth in cases that we were seeing 1 to 2 incubation periods ago. And based on the investigations that we've conducted there, it seems like it was largely transmission through small social gatherings rather than any sort of large omnipresent outbreak or anything being driven by a variant.
Okay, great. And we heard from a listener who travels for work and they will be getting their first vaccine dose in Maine, but they won't be in state in time to get the second vaccine dose because of their job. They'll be on the other side of the country and unable to return. In the state that they'll be in, they wouldn't be eligible for the second dose. So since every state has different vaccine rollout plans, is there any coordination between the states for people who, although it may be rare, there'll be other people who fall in that kind of category where they're traveling for work when, or for whatever reason, when the second dose becomes due?
No, my recommendation, Amy, is that when you get your first dose, you make plans to be available for your second dose.
So this would mean that the person would probably have to hold off several months before they return to Maine to get the dose. So there's no other alternative for that.
My recommendation is that when you make your plans to get your first dose, you simultaneously make sure you can get your second dose. And otherwise, you are risking not having the full efficacy of the vaccine on board.
Okay, thank you.
Let me turn it over to Chris Costa next.
Hi, Dr. Shah. Can you hear me okay?
I can, Chris. Go ahead.
All right. Hey, we've been getting a lot of questions about the number of open appointments that have been available. It sounds like, and I'm hoping maybe you can provide a little bit of clarity, that a lot of locations open appointments based on the supply of vaccine they've been allocated. Obviously, we want to fill as many of those appointments as possible. So what happens when we have these open appointments that don't get filled, and then we have these places that have vaccine, but obviously there's only certain people of eligibility that can go get those shots? What happens?
Yeah. Chris, I've looked into this. I don't know that there are as many unfilled appointments as folks are suggesting. I spoke last night with the individuals operating the Cross Insurance Center site to talk about allocation in general, and he indicated that they are fully booked for the remainder of this week and all of next week. Now, that doesn't mean they are not opening up new appointments, because we are, again, always transferring doses across the state throughout the week. We're moving doses from here to there and from there to somewhere else throughout the week. And as we find or are able to secure additional doses, they open up those appointments, but almost invariably they get snapped up very, very quickly. And so, as evidenced by the significant number of vaccinations that we've undertaken or delivered as a state in the last 24, 48 hours, there's not this systematic issue with a lot of appointments being unused. They may be open, but they're often getting snapped up.
Got it. You've talked now a couple of times about this sort of ebbing and flowing of supply. You've talked about it with the Johnson & Johnson, how they've kind of cleared out the cabinet, had to kind of restart their process. You also spoke earlier about this kind of one-time bump for this coming week that we're seeing from Pfizer. But with this ebbing and flowing of supply, do you have any projection as to what the supply is going to look like around the mid to late April time, when we have all of these hundreds of thousands of people that will be eligible?
Yep, sure, Chris. Let me also mention, in connection with your prior question, I also had the opportunity to speak not just with the operators of the Cross site, but also those who operate a site in Westbrook, the Scarborough Downs site, the Lewiston, Auburn Mall site, all of whom reported that same thing, which is they open up appointments as they secure their vaccine supply. And then once those appointments are opened up, they post them, and almost inevitably they get snapped up very, very quickly. So at the largest sites in particular, one of the benefits of them is that they can open those up with high assurance that not a single slot will go unfilled. Now, with respect to the projections of supply going into mid-April, we have not been given anything firm. Generally speaking, the White House or the US CDC gives us projections for the next week or two. So right now we're talking about next week, the week of March 29th, and then perhaps into April 5th. As I indicated, the supply of Pfizer will go down by then, so on and so forth. But all we've been told is that in general, the supply of vaccine is stabilizing and is still continuing to trend upward. We've also been told that we should expect the largest increases to our vaccine supply over the next 3 weeks or so to come from the increase in J&J. We've been told that the Moderna supply may not increase that significantly, and Pfizer may continue to see a small stepwise increase after next week's decrease, but that the biggest supply increases would be accounted for by increased production of J&J vaccine.
Gotcha. And my last question, Dr. Shah, has to do with the federal retail pharmacy program. What happens after the directive from President Biden, I guess, I don't know if expires is the correct term, but runs its course, I guess, through March 31st, this prioritization of educators, school staff, teachers, does that mean that the rest of the general public that's eligible in Maine will be allowed to get appointments there?
That's exactly right, Chris. So come April 1st, the federal retail pharmacy program will no longer give preferential slots for educators and childcare workers. They will continue to be eligible, but the openings will be available to any eligible Mainer. That is to say, those 50 and over right now, as well as childcare workers and educators. Right now in the system, those appointments must be reserved for educators and childcare workers until 48 hours before the appointment. If that is unfilled, then they can be released to anybody. That is per the Biden administration's directive. But come April 1st, those appointments will be available to any eligible Maine person.
Okay, and I'm sorry, I just wanted to follow up on that last point. I promise not to take any more of your time, but how much do you think that will help Maine's vaccine rollout accelerate once all of these sites are then open to the general public predominantly?
I think it will help. I can't quantify or even give you a directional sense of the magnitude, because right now those sites they've been vaccinating eligible people. That is to say, teachers, educators, school staff, childcare workers. What I think will change is that the composition of who they are vaccinating will change. Rather than vaccinating largely educators and childcare, they will be vaccinating a broader mix of people. There have also, so I think in that respect, it'll be helpful to broadening access to those who are 50 and over, or come April 19th, those who are 16 or 18 and over. So I think it's the program overall. I've been very pleased with it. We've been delighted to work with the partners we have, and we're thinking about what other partners we can bring on as well to broaden the access to vaccine to as many places in the state.
Thank you, Dr. Shah.
Yep, thanks, Chris. Over to Allison Ross next.
Hi, Dr. Shah. Thanks for taking my question. So is there any new information about why some of those long haulers, people having symptoms for 5-9 months after having the virus, are seeing fewer to no symptoms after this vaccine?
Allison, that's something that I was just chatting about with some of our medical officers not long ago. What is the recent findings around those who have experienced these longer term symptoms, and how might the vaccine help them or blunt some of those effects? There's still a lot of research underway, Allison, around why certain people experience long, protracted symptoms from COVID, and then why others resolve and bounce back within a couple of days. The latest thinking is that it has to do with the immune system, and how some people's immune systems just don't quite shut off after it's responded to COVID. Now, the vaccine may be helpful in that regard. Some folks who are experiencing those symptoms may be eligible for vaccine, and if so, the vaccine may help reset things. But right now, Allison, there's a lot more research that's needed to really get a handle on what's going on, and that's research that's occurring around the globe.
Great. And then just my final question here. There are reports saying that we should move away from calling this a respiratory respiratory or an inflammatory virus, and instead looking at more of a neurological virus just because of some of the symptoms like hallucinations that people will have. I was wondering what your thoughts were on that.
Well, a lot of times folks like to reconceive of a particular virus or medical condition as we learn more. And this has happened repeatedly in medicine. Folks who have asked whether diabetes is really about sugar levels and more about fat and lipid levels. And we've seen that with HIV. We've seen it with a number of infectious diseases. Recasting HPV. And this is an interesting finding in a lot of medical and scientific circles. As we learn more, we think about things in a different way. I think it's a bit early to recast or reconceive COVID as a neurological virus. It certainly has neurological manifestations, but a lot of respiratory viruses have neurological manifestations as well. Generally speaking, we think about viruses based on the part of the body that they affect first and foremost, which with respect to COVID is the lungs. So for right now, I think of it myself as a respiratory virus, but a virus that still has wide-ranging impacts on the body. For example, it also can affect the muscular system. It can affect people's hearts. We don't necessarily call it a muscular or a cardiological virus. So I think this is kind of how medicine and science works. It's always putting the same thing through different lenses.
Great, thank you.
Let me turn next to Joe Lawler.
Yes, hi. Thanks for taking our questions. Just a quick clarification question first. The J&J vaccine, 2 weeks from now, the week of April 5th, have you heard, will there be increases in supply for that vaccine then, or don't you know?
We don't know for sure, Joe. It has been signaled to me that there may be an increase the week of April 5th, but until we see it in our dashboard that we share with the CDC and Operation Warp Speed, I'll believe it when I see it. I was hoping for a more significant increase this week than we saw. I am thrilled that we are getting 6,500 more doses. I was hoping for something a bit larger. We all were. And so I'll believe it when I see it on April 5th.
Okay, thanks. And I just had another question on the FQHCs. The Biden administration indicated that eligibility could be opened up to essential workers or those with high-risk health conditions. Is that going to happen with Maine? It was also unclear to me whether that was a mandate or a recommendation. And do you think there'll be more doses flowing to the FQHCs because of that?
Let me answer both of those questions in a somewhat unhelpful manner. I had a chance yesterday to sit down and speak with some of the leadership at HRSA in DC and elsewhere, which is operating this aspect of the program, the Community Health Center FQHC element. And I asked them some of the same questions, Joe. I asked them a related question to your second one, which is, how is the pie being cut nationally? If there are 100 million new doses coming off the production line, how is the federal government deciding what portion of that to cut for states, what portion to cut for pharmacies, what portion to cut for FQHCs? And relatedly, as a function of that, should we expect the FQHC piece of that pie to increase in size or stay the same? From what I was told, they are still thinking that through. So I don't know whether the increase will go up. But I will tell you, Joe, that it is the intention of the Biden administration to activate more and more FQHCs across the country and thus in Maine. So over the coming weeks, more and more community health centers in Maine will be receiving direct allocations of COVID-19 vaccine for their patients as well as those in their communities. Now, we've already been allocating vaccine to them. So this will be, in some cases, in addition to what we have been supporting. And in some cases, it may be on top of or instead of what we would be giving them. But we welcome this additional supply of vaccine and additional activation to FQHCs. Now, with respect to essential workers, Joe, I haven't seen the official documents from CDC, HRSA, or the White House indicating what the parameters would be. around, say, essential workers and others. So without having seen those and studied those policy memoranda, I can't quite comment on what the impact would be yet.
Okay, one more quick thing. I was noticing that, and these are two very different places from Maine, but the Navajo Nation and Israel, both when they crossed the 50%, roughly 50% threshold of vaccinations of the total population, that cases were really driven down quite a bit after that point. Is that, do you see that as somewhat of a benchmark, or are there just too many variables to know? Curious your thoughts on that.
I wouldn't use the word benchmark, Joe. I would use it as a milestone of interest. What is happening there is the combination of individuals who have achieved immunity through vaccine, plus those who have achieved some degree of immunity from having been naturally infected with COVID, so-called natural immunity. In both Israel, as well as you mentioned, the Navajo Nation, I've seen similar data from other jurisdictions, some tribal governments, others from other parts of other countries. Generally speaking, when you couple those two, the natural immunity plus the vaccine-derived immunity, you start getting into that 75 to 85% range. Around 50% of people from the vaccine, 20 to 30% of people who have recovered from COVID. And Joe, as you'll recall, that's around the threshold, that 80% or so threshold, that is really thought to be the point for population immunity to emerge. So I think that's what's going on when you see that 40 to 50% range and then a diminution in cases. I think it's the confluence of both of those things, vaccine plus natural immunity, really taking hold. And, let's hope we get there really soon in Maine. That's the obvious point, but that's what we're driving for here. Interestingly, though, because we had so few cases relative to our population compared to other places in the country around the globe, we actually will need to vaccinate more than that 50 or 52 or 54%, because the percentage of our population that had or has recovered from COVID is so much smaller than it is in many, many other places around the globe. It's a good problem to have. Let's be thankful for that. Let me turn it over to Rose from the Maine Monitor.
Hi, Dr. Shah. Thank you for taking my question today. So pending legislation would make it more difficult for governors to extend a state of emergency after 30 days. How have these emergency declarations enabled you as the CDC director to respond to the COVID-19 pandemic? And how would restricting them affect future public health crises?
Sure, Rose. I'll divide, and I won't speak just for me. I'll speak more broadly for a lot of the work that so many people across the entire state government have been doing. And I'll divide the reasons why those declarations are critical into two areas. One is the way in which it streamlines many of our operations. A lot of the stuff that we need in order to mount a successful, effective response to COVID, a lot of the ways that we go about activating and marshaling those resources are streamlined because of those declarations. The ability to hire folks and bring on, say, contact tracers, case investigators, and others who are doing the day-to-day work. That process is greatly streamlined because of those declarations. To say nothing of so many other elements of state government that have had to ramp up their response, whether it's through bringing on staff or acquiring new materials, all of that is streamlined because of the emergency declaration. The other element that I think is critical is the fact that in an emergency situation, an emergency that was declared by the former Secretary of Health and Human Services, Secretary Azar, over a year ago, those declarations mean that certain streams of funding became available to states that are themselves operating under emergency declarations. The removal of an emergency declaration would mean that some fraction of the work that has been done at the state level would no longer be eligible for or be able to access some of that emergency funding that has been made available by FEMA and the US government. So those are just two examples. Certainly we can discuss more though.
And how would restricting these powers affect future public health crises?
Well, I think it's the inverse of both of those. If we had a future health crisis where we needed to bring on a whole new category of employees, like as we have with contact tracers or case investigators, without having the flexibility afforded by some of these declarations, as well as perhaps the ability to bring on more materials through procurement, if we weren't able to move that quickly, that nimbly, as well as to be able to access those pools of money that have been made available, that could slow our response down. Now, I'm speaking in hypothetical terms without knowing exactly the contours. I can't comment fully, but that's an example in which in the current pandemic, these declarations have been useful.
Thank you.
Let me turn it over to Charlie from Maine Public.
Hey, Dr. Shah, thank you. One quick follow-up question about the Aroostook County Jail outbreak. Do you happen to have a breakdown of how many inmates and staff were infected and just any other information about that one?
I do. I have it in my head from this morning's incident command briefing, but I don't want to get it wrong, Charlie. So we will get back to you.
Okay.
It's 4 total cases, but I will confirm and we'll get back to you very quickly.
Okay. And related, do you know how many, since the vaccine eligibility was extended to people over 60 in jails? Well, actually, I guess, first of all, does that now apply to people over 50 in jails? Have they been lumped in with that category? And then do you know what % of that group has gotten vaccinated so far?
Yep. So as to the latter question, I know that as of yesterday, about 100 of the 150 individuals who are in DOC facilities had been vaccinated, and that was yesterday's report based on Monday and Tuesday. Well, I think the vaccine was delivered on Monday. They probably started vaccinating on Tuesday. So that was as of close of business on Tuesday or so, which I was briefed on yesterday morning. I suspect, of course, it's gone up since then. Again, we can get you the exact number there of those 60 and over. As to the 50 and over, they weren't included in this week's vaccination activities because we placed our orders before we opened up the eligibility. So again, we placed our orders on Thursday morning by around 8 a.m. or so, and that was before we opened up eligibility. So that's why those 50 and over are not currently being vaccinated, but we are working on those plans right now. We have to put the orders in, they have to get them, they have to deliver them, all of that. So that's where we are with the next group of 50 to 59.
Okay, great. And I think Steve and Joe have touched on this in various ways, but I'm curious, when eligibility is opened up in April to everyone over 16, if there are any plans at this point to target some of the people with underlying health conditions or public-facing service workers who earlier on looked like they might be higher in the priority. I mean, are you going to be targeting them somehow?
Yep. So I'm glad you raised that. The answer is we are working on that, particularly those who have certain medical conditions that we know may put them at risk. So we are working with the providers that they may see on a more frequent basis. For example, perhaps oncologists or nephrologists, to make allocations to those groups so that those who are newly eligible don't necessarily have to jostle for an appointment with someone, because we know that next tier will have a lot of people in it. We haven't finalized those plans, Charlie, but that's generally how I'm thinking about that. Providing vaccine directly to the healthcare providers who may provide care for them as somewhat of a protected supply, if you will.
Okay. And sorry, I actually have just one other quick question is, back in December, there was a reduction in the contact tracing and case investigation that Maine CDC was able to do with increasing COVID cases. Have you been able to restore any of that, or I know the cases are kind of at a similar level now than they were back then, but.
Yep. So Charlie, what was going on back in December in particular is that the number of positive test results that we were receiving every day was more than our ability to process each and every one of those within 24 hours. Back then, we were getting on the order of 500 to 600 positive test results every single day. And so what we did was a couple of things. We put into place a system to prioritize those. We brought on more staff, because what was happening was that the cases that I was reporting out on a Monday may have actually been verified on a Saturday rather than on the day before. And so we weren't operating in real time back then. We were a couple of days, if not a little bit longer behind. But we brought on more staff. And as a result of that, now we have eliminated that backlog in positive tests. So the cases that I report out every day are the number of cases that have been reported to Maine CDC in the past 24 hours. That is to say, there is no longer any backlog.
Okay, thank you.
And Charlie, while you and I have been chatting, I have been able to confirm that at the Aroostook County Jail, the composition is 3 inmates and 1 staff member.
Oh, great, thanks. Yep.
Great. Over to Caitlin Andrews next.
Hey, good afternoon, Dr. Shah. I have some questions about independent pharmacies and the vaccine effort. I was sent an email by an independent pharmacist from earlier this week saying that they would not be able to get any doses because we're not expecting to get as much Pfizer vaccine, and it would delay some in-clinic efforts. And I wanted to check if this was still true with the expected increase in Pfizer that you just told us about, and also to get a sense if independent pharmacies are going to continue to be part of the effort, and if this is just like a temporary, I don't want to say like exclusion from doses, but if this is just a temporary effort.
Yeah, that would be a bit harsh. But you are generally correct, Caitlin. Independent pharmacies are not receiving a significant allocation this upcoming week. Right now, sort of where we are with independent pharmacies is trying to figure out what the next mission is going to be. So up until very recently, independent pharmacies had partnered with us to vaccinate various different types of congregate living settings that were not eligible under the retail pharmacy program, group homes of different types, things of that nature. And we had made allocations of vaccine to them. We've been tasking our public health nurses with going on site to long-term care facilities to vaccinate residents and staff who didn't get vaccinated the first go round. So the question that we're working on right now is how and in what way can we next and best deploy independent pharmacies? We're working with them to figure out what their next mission will be. Will it be to vaccinate in the community? Will it be to go door to door, homebound, things of that nature? We're working with them to sort that out. That's why you don't see any allocation to them for this upcoming week. The Pfizer vaccine that we received, that increase, that one-time increase, is largely being divided amongst the large-scale vaccination sites.
Okay, so and just to be clear, you said you're not seeing a significant increase or allocation this week, and then you said no increase. Is it, which one is it?
Ask me your question again. I want to make sure I answer it correctly.
I'm sorry, I'm getting my words switched up. Earlier, I thought you said that you were not seeing a significant allocation to independent pharmacies, and then I thought you said that they weren't seeing any allocation. So are they getting any or none?
Let me just double check so I don't give you incorrect information. Independent pharmacies for this upcoming week are not receiving an allocation of vaccine. Again, that's mainly because we are huddling to sort out what their next mission is going to be. The increase in Pfizer doses that we are receiving is going largely to the larger scale vaccination sites, and the Johnson & Johnson vaccine that we are receiving is going to a mixture of smaller independent hospitals as well as EMS agencies for drive-through and community vaccination clinics.
Okay, do you have a sense of how long they may not get an allocation? Like, do you view this as just temporary?
I think it is. I can't give you a week in which they will resume. Again, we've got to sort out what their mission is going to be. I don't just allocate vaccine and then figure out where they're going to go. I want to have a clear mission. I want to have a schedule in place. I want to know how many people they're going to vaccinate, on what days of the week, with what type of parameters in place. And then after we've sorted all of that out, then we make an allocation. Plan first, allocate second, not the other way around.
Okay, and then my final question was, I know that early on in the vaccination efforts, there were times when the retail pharmacy groups would sometimes get vaccines moved around because there was concern that they we're not using them fast enough. And I wanted to, it's kind of like, I guess, like two parts. How are you tracking that group's vaccine use right now? And are you satisfied that at the pace of their vaccinations, like if you had to move doses around recently?
Great. Thanks for that question, Caitlin. In a theme similar to my previous answer, plan first, allocate second, same approach with commercial retail pharmacies. As we have activated each and every one of them, we have gone to sometimes painstaking depth of detail to determine exactly how much vaccine they would be allocated from the federal government, and then only activate the number of stores that can use that weekly allocation fully and completely, so that we don't have any doses left over at the end of the week. So for example, when we activated Hannaford's, we got their entire list, or Walgreens is a better example. We got their entire list of stores with how many each store could do every single day, and then chose stores that were in areas of high social vulnerability and made sure that in the aggregate, they were only doing exactly how much their weekly allocation allowed them to do. That has greatly reduced the need to move doses around the state or have excess doses at the end of the day. The other thing to note there, Caitlin, is that the retail program works a little bit differently. They use a bit of a hub and spoke model. They have depots for vaccine, and they meter out the vaccine every other day or so to the stores that need it based on their scheduled demand. Again, that way there's not excess vaccine and there's no doses left over.
Okay, thank you.
Mm-hmm. And overall, I've been very pleased with the partnership, as well as the availability of vaccine. The locations that we've chosen to activate, be it Walmart, Hannaford's, or Walgreens, we chose deliberately. We looked for areas of the state where those outposts were adding something. They weren't taking away or competing with existing sites, but were rather adding something to the area. So we looked for places where we could activate where there was not already another supply available. That way they were used and have been used really well. The last question.
I'm sorry, just really quickly. You mentioned that the need to move them around has been reduced. Is it still something that happens occasionally?
With the retail program, I don't think we've moved any recently. I think maybe the first week we shifted around 100 doses, maybe 100, maybe 150. It was very minor, but because they use a hub and spoke model, there's not as much need to move things around.
Okay, thank you.
Yep, let me give the final question for the afternoon over to Dustin.
And I only have one question, so that might be good news for you. As you look ahead to summertime, we see airlines offering more service into Maine. Anticipation for more U.S. travel runs high. Governor's very optimistic about that and welcoming more people here. All of that said, are you keeping an eye on anything like variants or anything else going on in a specific part of the country right now in relation to COVID that might eventually inform the travel protocol in the coming weeks?
Yes, indeed, Dustin. That's a great question. So let me roll back a bit. Yeah, you may have seen in the governor's previous executive order regarding travel, where we changed a lot of our approach to travel. You may have seen in there a note whereby, and we've also discussed this, whereby if we here at Maine CDC detect that a particular state has an overwhelming prevalence of variants of concern, we have the authority, per the governor's recent executive order, working in partnership with others, to reinstate travel requirements for residents or those traveling from that state. So if a particular state starts experiencing an overwhelming surge because of a variant of concern, we can put back up the travel requirements that residents or those coming from that state test or quarantine before coming into Maine. But for all others, where those variants are not of concern, they can come in freely. We are keeping really close tabs on the evolution of variants in other states. There have been some that have been of concern. Some have been thankfully able to keep things under control. And I think that's been the story across the United States. Although variants have been of concern and have started accounting for more and more fraction of new cases, that has not yet led to the explosion in cases that we saw in December in the UK and January in South Africa. It could happen, but I think the strong pace of vaccination in the United States reduces the likelihood. But make no mistake, we are on the lookout for that. And if we see states being overwhelmed with new cases driven by variants, we won't hesitate to put those travel restrictions back up. All of that suggests, though, that if we can keep a close handle on these things like variants and new cases, we can get Maine back to the summer that I think so many are used to.
But there's not a specific state right now.
There are no specific states that are excluded or for whom travel restrictions are being put into place, but that very well could happen, and we are keeping very close tabs on it. Thanks, Dustin, and thank everyone. I'd like to thank everyone for your time today. Thanks to our colleagues in the media for the great questions. And thanks to all of you for taking a little bit of time out of your day to hear the latest on where we are with COVID. Again, I look forward to chatting with everyone again soon. But in the meantime, please, as always, be kind and take care of one another. Have a great afternoon.